And we're back. Welcome everybody to the GuideWell Insights Lounge. We're here at Singularity University's Exponential Medicine. Welcome everybody. My name is Kate Warnock. Right now I have a very distinguished guest with us here, Rob McCray. Rob, welcome to the interview.
Well, thank you very much.
Rob is the President and CEO of the Wireless Life Sciences Alliance. Rob, my first question for you, talk a little bit about what the WSLA, it's a trade organization that is dedicated to accelerating the convergence of wireless telecommunications and the life sciences industry. Can you share some of the successes you've seen so far in this role?
So, 15 years ago when we started doing this, the healthcare and the tech sectors didn't understand why they ought to be working together.
Right.
Now that's changed. It's demonstrable. You can see it now. So, Qualcomm was one of our founding partners. And they looked at healthcare as a place where they not want to go because it's highly regulated, it has arcane business rules, all of that. And now they are a major player in healthcare. Same thing, Johnson & Johnson, our other founding partner, did not understand how it could possibly use the tools of modern digital telecommunications to create platforms that would help their businesses. And now they're embedded in the process.
That's right.
So, and Google's there, Amazon is coming there, Apple is there. So I think we've helped spark a revolution that is changing our lives.
I think probably so many of the innovators here in this innovation lab are the recipients of the foundation that you laid so many years ago, aren't they?
And not only that, but one of my daughter's classmates at Berkeley started a company called Echo, and it's here. So,
oh my gosh.
15 years later, my next generation is starting companies that are being funded and
well, what a validation for a vision that you must have had so many years ago, so that's outstanding. Rob, as you mentioned before, you operate between two highly regulated industries. How would you like to see policies change to enable that integration you seek between telecom and the life sciences?
So actually, there are other regulated industries that are better models, and this is where we want to go. So look at the automobile industry. In the automobile industry, we don't do pre-market certification of every device, even though they're very dangerous. They're put in the hands of regular people to drive in all conditions. And despite that, they're safer to drive now than they were 40 years ago. They're cheaper than they were. They have more conveniences. They're more comfortable, all of that. So can we not do that in medical products? That's the question we pose. Okay. We have the tools to do it, and that's now what we're focused on accomplishing.
Great example. I think everybody could relate to that. Next question for you, Rob. In your opinion, what is the single greatest barrier currently limiting the future of health and medicine?
Well, there's two. People are not engaged with their own health and healthcare. We sort of have separated ourselves from that and given it over to doctors and hospitals. Right. That's a bad equation. And the other part is this problem of innovation. So innovation is fast. Regulatory processes to keep us safe from innovation are slow.
Right.
And so we have to change that. And in doing so, we will have a more engaged consumer, a more engaged patient, and we'll have better products continuously improving in real world use, rather than having a process where it costs over $1 billion to bring a new drug to the market today.
Right. But with the experience that you have where you had that vision 15 years ago, I can only imagine where you're going to be taking us in the next 15. One more question for you. How can the wireless telecoms industry better manage the increasing costs moving forward?
Well, actually, I think telecoms is doing that by recognizing that their core businesses are commoditized, bandwidth. So they're looking to enable new platforms, including connected health, connected home, to bring value-added services on top of their core infrastructure. So you're getting more out of telecoms now per dollar of investment than we did 15 years ago. It's healthcare that is behind in that equation, and hopefully they're going to be part of the solution for our rising healthcare costs and rising inaccessibility of healthcare.
Rob, I forgot to mention that you had just led a workshop here at Exponential Medicine. So hoping you could kind of recap for us what was the workshop about and what were the outcomes from it?
So the workshop is about a concept called open outcomes-based regulation. And the notion is that we can use real-world evidence to bring and evaluate medical products in the real world, so drugs and devices, and evaluate their safety and efficacy based on real-world evidence rather than pre-market randomized clinical trials.
I'm sure that was a very, very exciting and deep discussion and deep learning. We keep hearing that. I'm sure that certainly happened in your workshop today.
That's right. Yeah, no, it's a great group here.
All right. Well, Rob McCray, thank you so much for joining us here at the GuideWell Insights Lounge. My name is Kate Warnock. We'll be up again with another interview soon.